So good morning, everyone, and thank you for this opportunity. As you can see from also my slide, I come from Bocconi University, and in Bocconi we have an observatory on private consumption in healthcare, and one of the streams that we're following recently is actually how medical tourism is developing in Italy, and obviously as a phenomenon worldwide. I will share with you some of the thought about what's going on in this country and why we're not taking off as we expect, and what we are doing in order to make this country more attractive and a better place for developing medical tourism in a full way. As you know, I mean, this has already been said, so I've been very quick on this. It's growing, but the moderator already told us actually there's a lot of hype about medical tourism. There's an estimation which are not really probably correct. In any case, you can also probably get from the previous speakers, there's quite an interest by a number of providers in this country to develop in that area, and certainly we do believe that given the combination of excellence in clinical activities and all the other, let's say, strength that this country has in terms of food and tourism and so on, there's quite an opportunity in that field. And further, as already been said, Italy is quite high in the ranking in terms of NHS and health system. Certainly we have strong traditions. There's also the idea that basically medicine was originally certainly developed in Greece, but then first university and medical school was established in this country, and we have quite a very renowned bunch of clinicians working in scientific societies worldwide. And much of the new technology is also developed in this country, even if not many people know this, but there's quite a lot of medtech evolution going on. So why are we not taking off? For a number of reasons. First of all, even if we believe we might have this strong combination between the healthcare sector and the tourism sector, the tourist operators doesn't seem to be so interested because they don't really need it. I mean, they already have quite a lot of people coming in this country for other reasons, so they don't see really that as a further opportunity to develop. So there's the creation of a network, as the one we saw in other countries, in Malaysia and Thailand, is not coming as easy because the tourist operator and all the let's say the business working in the tourist field are not doing their part in this sense. We don't have specific policy at system level, not yet. I mean, something's changing right now in this few months, but already it's been told by Luigi Bertinato, as for instance, we're not doing as we should in terms of introducing the European directive and so on. There's often not a clear competitive business model. That's something that also was introduced by the moderator. So the strategy itself often there's a lack of good strategy of target selections. We're still actually trying to identify what business model we should actually develop. One of the reasons is the fact that even the private providers in this country has been working for 30, 40 years in the NHS, so they develop their business model based on the NHS basically model. So now they need actually now to shift to a different mentality and mindset when they move to international patients and different classes. So that's something actually takes time. They're moving quickly in that direction. You already listened to Pellicero and Cazzaniga and Pellicci, so something is going on, but it's still a process of change. There's a path dependency towards what we call traditional private practice. That's another issue that many countries has. When you have clinicians that can do their private practice together with the practice they do because they're employees of the hospitals, that conflicts with the idea that the hospital itself develop further activity on the international level because they already have their agenda full, and so they don't really need it to do extra activity with international patients. So we need to free some of the time and then find a new arrangement of that side. And there's a lack of rules and bureaucratic constraints. We've been working on the visa issues and a number of other issues concerning the fiscal policies and so on. And there's no stakeholders forum which the different actors can bring together and try to create a platform to develop their activity. So we learn from other countries that actually we need certainly to develop a business model for attracting international patients, specifically have in mind what kind of targets. And this country is going quickly, as you also probably felt from the previous presentation, to a specific idea that what we want high complex, high technological activities, which means that we're going to look for high spending patients. We have selected a limited number of the international, rather say, patients or clusters of patients that we're going to look after, where we can probably put a maximum the capacity that we have in this country in terms of clinical excellence and high technological hospitals and so on. And on the other side, we need certainly have to develop a better system approach. We're working on this. What I'm saying is that the fact that we have this event here in Milano in 2017 is because in the last 3 years something is going on, and now we're preparing the field really to take off, and we have expectation maybe that we're going to be one of the countries that are going to increase the number of patients attracted on international scale. Where to invest, so where we should actually put our focus when we look at Italy. Certainly we need all providers to think about what portfolio of services they can offer international market and make some good, rather say, calculus about the economics of that. Often most of the providers don't even have an idea about what they can offer and where there's a gap, where there's a niche or a cluster of clients. They need to develop a dedicated team. We can learn from other hospitals, Burungrad hospitals, or many others that we know actually they have a fantastic team dedicated to this, and we still actually running below that. We need to develop a case management approach. Again, we were impressed by what others are doing, but I think the Italian hospital can make it to this point, and then obviously build an integrated offer with logistics and the entertainment side and so on. When it comes to medical tourism, we also need to invest making this a political priority. That's what we're doing actually through the activity we run in our university, but also through this event and many other things that are going on in Assa Lombarda and the associations and so on. There's certainly issues in visa management that we need to solve. We need to introduce fiscal advantage. It might happen. That's something that in Lombardy regions is under discussion because that's something that obviously from a system or from a country perspective is something that you want probably to incentivize. Creative platforms, move on international accreditations. Stefano Cazzaniga just told us that Humanitas has been accredited since 2002. EAO, l'Istituto Europeo Oncologico, is also accredited, but also some of the public providers. So we need actually to create some more awareness that actually we need to some extent have titles and logos and so on to push our providers. And certainly we need to introduce new rules for private practices. As I said before, there's a kind of an internal conflict between how much the single providers can develop their business activity and the fact that the clinicians in these countries are allowed to manage on an individual basis private practice in competition with the institutional practice they perform because they are employees of a hospital. I'm coming to the end. And third area in which we need to invest a lot, and we're working on it, it's promoting the Made in Italy. That fact, I'm making people aware that actually Italy is a place of excellence for clinical care. I personally run a master in Bocconi, an international master. I have every year more than 40 students abroad. I have 26 nationalities represented this year. And when they come here, they often discover actually that Italy is much diverse from what actually they expected before, because we do have a fantastic health system. We do have fantastic clinicians and hospitals. And because of the image that this country is often getting for other reasons worldwide, we don't really convey the right idea about what we can do and what we can offer in that terms. We need to increase the capacity to use patient storytelling in Italian. Actually, I mean, it's a place where you can come and have a good combination. I was discussing the other day with the manager of the public hospital Bergamo. Bergamo, it's a medieval city here in Lombardy. They have an airport, which is becoming the most important in Italy for low-cost flights, but also for the connection they have worldwide. The large hospital Bergamo, it's a really huge hospital, 1,000 beds, a lot of high specialty technology. They have robot da Vinci, everything basically. They now have acquired a second small hospital in Val Brembana, which is a valley north of Bergamo, and they're thinking about transforming this hospital in a sort of a boutique hospital for international patients, because now they have the platform with the airport, the large hospital with the clinician. They can move the top clinicians up there, or keep the patients in Bergamo and then bring them in Val Brembana. And in Val Brembana you have the Terme San Pellegrino, and then you have the ski resorts, and then you have a number of places. So you can have a combination that would be certainly successful. And then you can Bergamo and get medieval city, and then in half an hour you're going to be in Milano, and so on. So I don't see any reason for which we should not actually be attractive to some extent. And if we start building platform and making system across the different actors. We have an international network of clinicians, very, very strong. So our clinicians are worldwide very renowned, and they participate. So that there's all conditions there, but we need to build obviously geographical integrated clusters. So this is it. It's just a quick summary of things that we're doing and the agenda on which we're working. So thanks a lot for my time, and the floor is off to you.